just go full screen. Hi, everybody. Because it's so hard for me to see you in your classrooms on a daily basis, I've decided to do a screencast for you on allergy awareness, and I'm also working with a Durham nursing student, Cassidy. Yeah, go ahead.
So, what foods are we not allowed to bring to school? Peanuts, tree nuts, and any outside foods without approval are not allowed to be brought into your school.
And so you want to seek approval from Miss Parnsley or Mr. McSweeney, and you just need to be very careful and read all of the labels of anything that you do bring in to make sure that there's no nuts in it, or it may contain nuts.
Why are we not allowed to bring these things to school? Other students may have allergies to these foods. Contact, ingestion, or even inhalation of some of these foods can pose a threat to these students. What could happen if we brought these foods to school? Students with food intolerance or food allergies could be at risk for various allergic reactions. Examples include skin irritations, gastrointestinal problems, or anaphylaxis. So what is an allergic reaction? An allergic reaction is a sensitivity to substances called allergens. We know these allergens as common allergies like nuts, shellfish, pollen, bee stings, medications, etc. When these allergens invade the body of someone who's allergic, the body's immune system reacts to fight these allergens off, thinking that it's an invader. We see this as the signs of an allergic reaction.
So why do allergic reactions happen? So why do the hives happen? Why do people get anaphylaxis? Why do they feel nausea? The body kind of acts as a bit of a patrol system. Your immune system works as the patrol system. So if any of you have gone out of country to get on a plane or cross the border, you would need to show your passport. The body's very much the same. So when germs and allergens come into the body, your body will kind of check the cell out, make sure that it's safe for you, and then it'll either let it pass or it will sound off the alarms and start an immune response, which is how the allergic reactions happen.
These reactions can happen by touching a contaminated surface, sharing snacks and foods, inhaling proteins from allergens being cooked, eating a food cooked in a certain oil, or taking a medication that has the allergen in it. Symptoms of allergies and reactions could be skin irritations like rashes, hives, or eczema, gastrointestinal like nausea, vomiting, or diarrhea. Sneezing, runny nose, and shortness of breath can also accompany any of the other symptoms, and the worst symptom is anaphylaxis. So anaphylaxis is a life-threatening allergic reaction. Some symptoms of anaphylaxis include swelling, especially of the lips and face, throat tightness, difficulty breathing and speaking, vomiting and diarrhea, hives or pins and needles of the skin, coughing, sneezing, a drop in blood pressure, and loss of consciousness. The number one treatment for anaphylaxis is epinephrine. We know this as EpiPens. Just as a side note, we've included that all persons with assumed anaphylaxis reactions must go to the hospital. So some steps on how you can help with allergy awareness at your school. Don't bring these allergens to your school. Read the labels of everything that you are eating and bringing in. Know where the emergency medications are, and know what to do if someone has a reaction.
So we have 3 EpiPens around the school. There's one just inside the kitchen on the right-hand side inside their first aid box. There is one just outside the junior labs near the AED in the orange bag. And there is one in the gym in the AED box just beside to the right of the gym doors. It's important that you know where these are in case a teacher needs you to go and get one. You will never be expected to administer an EpiPen, but you might be asked to go and get one for a teacher.
What to do if someone has a reaction? Some simple steps are find the nearest teacher, yell for help, call 911 if anaphylaxis is expected, You probably won't be the person that is designated to call 911, but just having the knowledge that that has to happen is an important step. And also find the nearest EpiPen.
So if you want in your own time, you can go on YouTube and watch this video. It shows you just kind of a different perspective in terms of food allergies. It shows you the perspective of a person or a parent of a child who has a food allergy, and they talk about their experiences with it. We really want to stress that you don't bring nuts into the school. We've had some incidents where that's happened, and we just want to keep everybody safe. And also, as a side note, for residents, students bringing food into the school, please, please read all of your labels and make sure that there are no nuts. Thanks for watching and have a good day.